Thank you. And thank you, Senator Bacic, for bringing this bill here this evening. Last year, Meghan Markle documented her personal experience of miscarriage in a New York Times article. Her words therein have instigated an open and public discussion on the topic, which truly underscored the need for reproductive health leave bill. She wrote that losing a child means carrying an almost unbearable grief, experienced by many but talked about by few. I agree with her comments. Women who have experienced miscarriages have often suffered in silence, without public or private support. It is only right for Oireachtas to recognise that losing a child before birth is heartbreaking for parents, and as Meghan Markle pointed out, it is heartbreaking, which requires time for healing. It is only right for the Oireachtas to recognise the inadequacies of Ireland's current stance on reproductive health leave. It is only right for us to support this bill today. In the briefing paper for senators on the reproductive health bill, we were informed that 1 in 5 pregnancy in Ireland ends in miscarriage each year. 1 in 5 parents experience the unbearable grief. 1 in 5 pregnancies annually leave parents heartbroken and perhaps in need of support. Up to 14,000 women a year suffer the death of the baby before 24 weeks gestation, and yet, as Niamh Connolly-Coyne from the Board of Directors of the Irish Neonatal Health Alliance has pointed out, there is no statutory entitlement for paid leave for those parents experiencing the tragedy of miscarriage. Today's bill proposes up to 20 days leave for women and their partners who have suffered early miscarriage. If a woman has a stillborn birth that weighs more than 500 grams and has died after 24 weeks gestation, she is entitled to full maternity leave for 26 weeks, as outlined in the Maternity Protection Act 1994-2002. Paternity leave is also a statutory entitlement in these circumstances. The fact that the Government offers no statutory protection for a woman who has lost her baby a mere week earlier is, as the Irish Neonatal Health Alliance have explained, unacceptable. They urge the Government to address this matter urgently. I urge the Government to address this matter urgently. We must ask, what difference does 23 and 24 weeks gestation make to a woman grieving the loss of her baby? It does not matter to a woman whether she has miscarried her child or whether the child was stillborn, as Mario Rosenstock remarked in the Irish Times interview last week. It is the expectation that the burgeoning life that is coming, and it is your preparation for the expectation of life coming into the world, and then for that to be cancelled, is so sad and shocking. What is the Irish Government doing to offer support to these parents? Irish women, too, should have these entitlements where the reproductive health leave bill would offer them. I hope this debate and ultimate passage of this bill will ensure the conversation about miscarriage will take place and women and their families will be able to make that healing journey a bit easier. However, let us not be naive as we consider the full effect of this legislation will have. Firstly, it has brought to light a number of issues in Irish law and Irish healthcare relating to reproduction and fertility. Under the 1994 Stillbirth Registration Act, there is no provision for registered babies that die before 24 weeks gestation. The Irish Registered Neonatal Death Alliance has suggested that today's bill contains measures to allow an opt-in recognition of these babies. Will the bill include these measures? Furthermore, there is no provision in Irish law to help to cover the costs of a child's death. The Irish Neonatal Health Alliance has commended Kildare County Council, as Senator Curry mentioned earlier. Will this bill include the provision for children's funeral funds as implemented in the UK and Wales? I know many undertakers in this country actually do free funerals for babies that are born, so I want to commend the undertakers in this country that actually do provide that service. And what about the implications of the bill as written, regardless to the amendments which might be made to it? Will it make employers in the private sector more reluctant to hire women, given the potential cost providing leave for them may have? The bill proposes there be an entitlement of up to 10 days leave for those seeking reproductive healthcare treatments such as IVF. The bill is not clear as to all treatments and all types of losses that should be entitled to leave. Will women who are expecting loss after an abortion be included by the bill? Without clarity of such issues, can we have clarity on how the bill will impact women in the labour force? The legislation we are debating over today has been proposed in response to concerns by actual members of Ireland's labour force. Representatives of the INTO approached Senator Brackish for assistance with the matter, and undoubtedly the Oireachtas must respond. There is a certain humanity and respect owed to this situation that both Meghan Markle and Mary Rosenstock, and indeed the many women and fathers that have lost their child, described equally as heartbreaking in this manner, and the current Irish law is missing that. However, in their response, the legislators must carefully consider what the scope of the reproductive health leave bill is. The legislators must discuss and consider what amendments will be made to this bill. The legislators must consider the likely impact the bill will have on females in the labour industry. And for women business owners, and I mean, I would have owned my business all throughout my career. We have responsibilities to our employers, and I know the last thing that you'd be thinking about when you're having your child, but you do worry about, if you're not there, who's going to pay your wages for your staff. And I would have found that very, very hard. You know, when I was a woman in business, there's nothing in legislation that allows for us paternity leave or maternity leave or anything like that, or indeed for miscarriages either. So I think that's something that we could address. I don't know how you're going to address it for women in business and for women entrepreneurs out there who have a responsibility there to employees. Thank you.